Diabetes type 2. It's a chronic medical condition, defect in how the body controls and uses glucose for energy. There are two primary interrelated problems: insulin resistance and impaired insulin secretion.
The International Diabetes Federation reported that the prevalence of diabetes in United Arab Emirates reached to 60.3 compared to 9.3 worldwide.
The risk factors of type 2 diabetes include obesity, physical inactivity, history of gestational diabetes, age, and high blood pressure.
Clinical manifestation. Symptoms of type 2 diabetes usually develop over time, and the signs of symptoms of type 2: fatigue, blurred vision, slow healing, frequent infections, feeling very hungry or thirsty, increased need to urine usually at night, weight loss, tingling in your hands or feet.
The complication of type 2 diabetes is heart disease and damage to blood vessels, nerve damage, neuropathy, kidney disease, slow wound healing, and hearing impairment.
The diagnostic test of DM type 2. The first test is glycated hemoglobin. The blood test report average blood sugar and result are less than 5.7% of normal. The second test is a random blood sugar test. It measures the blood sugar level at a level of 200 mg after eating. The third test is oral glucose test. After fasting overnight and then drinking a sugary liquid, the blood sugar level are checked for the next 2 hours, and the results are interpreted less than 140 mg is normal. The last test is fasting blood sugar. A blood sample is taken after an overnight fast, and results of less than 100 mg are normal.
Hypoglycemia is the most common life-threatening condition which require immediate nursing management. So the nursing management is administer insulin and hypoglycemic medication, educate the patient for home glucose monitoring, and usually check for expiration date for the medication, assess blood glucose before starting and doing the activity. Do not inject the medication at the exact site each time, should be different spot each time. Also choose the food described as having low glycemic index. Health promotion. We are focused in care of the people with diabetes type 2 and keeping them healthy. Healthy diet. People with diabetes can have benefit from eating food that are high in fiber, vitamins, and minerals. There are foods that diabetes patients should include in each of their daily meals: fruits, vegetables, whole grains, and nuts. There is also foods to avoid to prevent glucose spikes are like fatty, dietary, and sweet. So in the activity, physical activity is very important for people with diabetes. Being active makes the body more sensitive to insulin, but the patient should check the blood sugar before being physically active, especially if they are taking insulin.
Type 2 diabetes can be treated with different types of drugs. Insulin is a drug used to manage blood glucose level. It's grouped into several categories based on the onset, peak, and duration of action. Second, oral anti-diabetic agents like metformin, Gelectrol, and sitagliptin. They all work in way to control blood glucose level. And there is other pharmacological therapy. It's used to control hyperglycemia in adults who have not attained appropriate glucose control level even with insulin, exercise, and healthy diet, like bromelated and oxynatate.